I'm Amanda Hayes-Fugit, and I'm a pelvic physical therapist with Pelvic Forward and pelvicforward.com. Today I want to talk about, shockingly, the pelvis and the anatomy and some of the function of that area. Today I'm going to use a female pelvis to illustrate this. I will do a video on a male pelvis in the future, but just so you know, men, there's still a lot you can get out of this. The muscles are virtually the same between men and women in this part of the body, but we'll highlight those differences later. So this is a female pelvis, and if it was me, it would be sitting just like this. This is where my pelvic bones are. This is where the spinal column or the bones come down and attach. And in here is where your femur, or this long bone, comes into the socket and forms your hip. So all those things influence how this part of the body works. But now, attached to that, most superficially, we have all these small little genital muscles. These muscles invest or attach into the genitalia and into the sphincters. So this is part of what helps us to close things off when we need to, stopping urine, pee, or bowel movements from coming out. But we also need to be able to relax this area fully to have things come in and out the way they're supposed to too, for intercourse, again, defecation, urination, all of those functions. Now I know these muscles look really special, but I can promise you they aren't. They have the same problems as all of our other muscles. These muscles can get sore or tender. They can be weak, strong, tight, loose, coordinated, incoordinated, all those same things as your arms and legs. So that's the first layer. Deep to those, we have another layer of muscles that help to stabilize the organs that fit in that part of the body. And then deep to that is the third layer of muscles, or the pelvic floor. Now usually if you've heard about this part of the body, these are the things you've heard about the most. And this is a nice bowl of muscles that starts at the pubic bone and goes all the way back past the tailbone or the coccyx. So this literally forms this nice bowl to hold all the pelvic organs. So first is your bladder. It sits right behind that pubic bone. After that is the uterus, and that goes down into that vaginal canal. And then right behind that is the rectum, the intestines going down into the rectum. So you can see this is not a very big space, and the pelvis can get a little gossipy. Meaning, if you have a problem in one of these functions, over time it can start to turn into another problem. If you have urinary leakage, you may end up with some pain in your SI joints or this part of your back. If you have constipation, you may find that you start to have urinary urgency or frequency. Same thing is true in the other parts of the body, right? If you have shoulder pain and it's not dealt with, eventually it may turn into neck pain or decreased range of motion. Now, these pelvic floor muscles are special in the sense of what their job is, right? Their job is part of what holds us up. It's part of our stability of this part of our body, together with our abdominal muscles, our deep back muscles, and our diaphragm. That's truly what forms our core. These muscles also help to influence our sexual, our bowel, and our bladder function. And they surround a bony outlet, kind of like our cheeks do on our face. So these muscles can contract, they can relax, and they can bulge out. And we do need all of those motions to have a healthy pelvic floor. Now I know many of you are asking, how is it that I do that? Using this part of the body is hard because we can't see what it's doing. If I wasn't using my arm properly, I could probably see that in a mirror or have someone point that out to me. But because of where these muscles are, you really do need some specialized, individualized care to help you figure out what's best for you. So a pelvic physical therapist, another kind of practitioner, may be really helpful in helping you figure out what it is you're doing with your body so you can make it better. Again, I'm Amanda Hayes-Fugit with pelvicforward.com.